Well, fantastic. Well, Dr. Sharma, is there anything else that you would like to add about your research project that we're trying to get some funding for?
So I'd like to add that it is this type of um, support, and I don't want to call it little, but it is this type of pilot support that really jumpstarts big projects and leads to breakthroughs, better trials, innovation. Because the next steps to take it back to a clinic in a trial requires larger amount of funding,
Mhm.
but it is always hard to get the initial pilot to ask the
Mhm.
question. Um, and to me, um, the support that we've received in terms of pilot funding, philanthropy from patients, I think has a lot of meaning. It's always nice to get a federal grant, big dollar amounts to do a large trial, which eventually will change practice. Um, but we get there only after support from lots of other entities before we can actually change practice.
Great. Well, I'd have to tell you personally, I really appreciate that your focus on triple negative breast cancer as well as other kinds of breast cancer. You are an amazing clinician. I know you from that aspect, but also looking at all the research that you do, which is really helping to advance the field. We are so fortunate to have you at the KU Cancer Center and in the Kansas City metropolitan area, and actually impacting the entire world of breast cancer. I promise you that we will raise $15,000 for this research project that's being spearheaded by you. And I look forward to seeing you soon and opportunity to get some pictures in your natural setting.
Yes, yes, and thank you so much for undertaking this and for doing this for so many years. Um, I can't even count the number of years you've been doing it. And then thank you for being part of Pivot, our patient advocate group. We really need more and more survivors, co-survivors to be part of patient advocate groups because that is how we are able to develop research strategies and design trials that not only fit the scientific uh, question and hypothesis, but fits what our patients need. Because you can have the best question and hypothesis, but if it doesn't align with what the needs in clinic are, we will never answer it.
Sounds great. Well, thank you again very much, Dr. Sharma. And